What's up, guys? This is Nicole from the Barbell Bombshell. We have Dr. Bernard of Spectra Wellness here, and we were talking about basically the relationship between the scapula, shoulder, and the thoracic spine.
Yes.
And I was talking to him about, people come to us, they have poor posture. He was saying it's not necessarily the posture, it's being able to get into that position with the shoulder blades doing what it's supposed to do, particularly related to kipping pull-ups, toes to bar, anything hanging from the bar or putting our head through from the back.
Gotcha. So a lot of the times when people are worried about shoulder things, they come in and they've got this posture that's here. Now, the shoulders being here by itself isn't that big a deal. If you have the ability to move from there. So if the shoulder can now move back here, move up here, move down here, we're doing okay. If we're stuck here and we don't know how to control our shoulder blade or control our scapula to pull it back, and I now ask my arm to try to come back here, well, I'm now compromising my glenohumeral joint, the ball and socket joint of the arm, because the shoulder blade itself can't move with it. So if you have someone who's having some issues with an inability to do hanging things, the toes to bars, the kipping, we want to make sure, do they even have the prerequisite ranges of motion to get there? So a really cool, really simple test that you can do. Nicole, I'm going to have you lie on your back. I'm going to have you pull your knees to your chest. So what we're doing right now is we're putting her in a position where her spine is totally neutral. She can't use it to cheat. And what I'm going to have you do is just bring your arms up over your head. So what I'm looking for right now is, can she get her arm totally straight, totally locked to the ground without compensating through her spine? And in Nicole's case, we actually do have a little bit of space here, which is telling us that this is a range of motion that we need to work on a little bit. So what's going to happen when she tries to do a pull-up, if she wants to get her elbow all the way to the ground, she's going to cheat. So bring your elbows to the ground. So she's going to cheat by actually arching her low back a little bit. So we're now compromising ranges of motion other places in the body to make up for lack of shoulder flexibility. So if we find that, hey, we put someone on their back, knees to their chest, arm can't get down to the ground, we've got a limitation in our shoulder flexibility range of motion. If it's just tight and we can't get there, we just need to work on flexibility. If you're feeling a pinch on the top as opposed to tightness in the bottom here, that means we have a little bit of a compromised joint, we have some compromised joint integrity, some rotator cuff stuff going on. We want to talk to a professional about that.
So with me being limited in this position, what should I be looking for? How should I even address that? Should I go to a practitioner? Should I work on myself for a little bit temporarily to see if there is a positive change?
Well, doing the CARs, the controlled articular rotations of the shoulder joint, of the scapulothoracic joint, doing that consistently over a couple of weeks, you might find that this takes care of itself on its own. If it doesn't, and we're doing our lacrosse ball stuff, doing our foam roller stuff, and we're still not getting our improvement there, that's when we want to talk to someone about that. However, going to that same position, what we'll find is if we bring her arms out just a little bit wider, boom, elbows now get to the ground. So for her, this might be her working range of motion for a while until we get the flexibility to get in through here. So when she's doing hanging stuff, when she's doing overhead stuff, having a slightly wider grip is going to be healthier on her body because this is a range of motion that her shoulder can control. We get her here, we don't have the flexibility to have full control there. Things start to get compromised.
So basically, your body will take a lot of crap from you. It'll do what you're asking. It's just at some point it's going to compensate somewhere else.
Exactly.
And that leads to injury.
Definitely.
All right. So there is basically how to screen for going overhead, whether it's hanging, pushing, pulling. Kind of some homework. Refer to the CARS video that we posted about the scapula and the shoulder. And let us know if you guys have any questions. We can make more videos about what you're looking to learn about and help you to be a better human and move better.
Absolutely.
Thank you, guys.